So we're here to continue talking about hand posture. So we've already spoken about the yoke hold, right? Now what we're going to talk about today is just a broad hand. Now with the broad hand, essentially the easiest way to show it is generally this. So all the fingers are together, including the thumb. Now you can use this as a flat hand, but you want to do that on a flat anatomical structure. So for whatever reason, should you be palpating the abdomen, a flat hand will generally work. No matter what you're doing, the idea is that the broad hand, or the kind of the hand that can be broadly deployed, on any surface that's contacting, you're going to want that to mold, right? So if I put a flat hand here, right, then this area of my hand, if I don't mold to the anatomy that I'm working with, is not in contact. So essentially I've defeated the purpose. The purpose of the broad hand is to broadly contact a large surface area for multi-point discrimination. So as I contact the forearm, I want to, and you can watch my thumb here, I want to mold to that to the best of my capacity. Once the hand is in contact, what I can then do with it is I can essentially, because my hand has a lot of dexterity, or anybody's hand has quite a bit of dexterity, I can individually check areas. So I can apply pressure here. You can see my thumb kind of turn in, and I can see what tissues yield under there. I can push in here, see what yields there. I can push on this knuckle. I can push at this interphalangeal joint, that finger pad. I can check all of those things. I can essentially, under the entire hand, I can see where there's more, where there's freer yield or less free yield of the soft tissues. I can use the broad hand in a situation like this. So in this case, this is just, there's a little bit more to this. So because of the camera angle, I'm not going to use two hands. But what I'm going to do, you may not necessarily see it, but if I try to move the tissue, right? If I try to move his soft tissue in relation to the bones, then his arm's going to roll around. So what I'm going to do is I'm going to stabilize, right? So I'm going to put my forearm in his forearm, and then that broad hand is able to check what's going on with those tissues, right? So I can pay attention here, I can pay attention here, I can pay attention over here, whatever I need to do. But once that hand is molded to the anatomy that I'm interfacing with and in broad contact, then anywhere that I'm in contact, I can start to figure out what may be going on with motion. Now, the yoke hold that we talked about previously can be utilized, and let's just say I want to broadly look into a joint, right? This hand, right, I can go and I can put it on the posterior surface broadly. So I bring it in, I mold to the area, I open the joint up, right? I move through that joint, and at that point I can identify where there is freer motion and less free motion comparatively side to side. In the case of the position that I have the patient in here, there's less free motion on the lateral side. Now I can do a very similar thing on the anterior surface of it, right? I can mold to the anatomy and I can pay attention. And again, in a comparative sense, what I'm noting based on palpation and based on vision is that there's more restriction on the lateral side of this patient's elbow. Therefore, because of that broad contact, I've differentiated. I have my multi-point discrimination, I've broadly contacted, I don't have breaks in my hand, so I'm not missing information. So you see here, if I have my hand splayed out, I could be missing information. And if you want to try this out for yourself, anywhere that you're palpating, what you do is you have a broad hand where everything's brought in together, or you have essentially an open hand, or a hand where you splay the fingers out, and you compare and contrast your capacity to identify where there's motion restriction. Whatever you find is what you find. I'm not going to tell you what you're going to find. There will be times when one hand posture is a little bit more advantageous, and other times where the other hand posture is more advantageous. But in the case of the broad hand here, I can identify the motion restriction in the elbow better than with the open hand, right? Because again, it's harder to map that on a sensory level, or at least it would seem to experientially. So in my personal experience, it's harder to figure out what's going on with a broken sensor than it is essentially with a connected sensor. This makes more sense. The key being that it's a broad hand, everything's together, right? So you're not having gaps in sensory information, and you mold to the anatomy however you need to. You don't stay flat, missing essentially contact areas. And then at any point that you create motion, whether it's motion with your hand to test soft tissue yield or motion with the patient, you passively move an anatomical structure, you can then identify where more tension or where more free motion, more restricted motion shows up. But again, the keys being hand is connected, hand molds broadly to whatever area you're trying to figure out, and then you can individuate or localize essentially on the hand. So we talked about previously with the concept of palpation, moving from the known to the unknown. So that broad hand allows you to have a broad surface area, and then the idea of getting as much as you can touch in a broad surface area. So this could be called a global hand, right? So anything within here that shows restriction of motion, I can then move to where I needed to. If I wanted more sensitivity, I could go more to the finger pad. So if I identified something here, when I'm contacting, I identify something here, and I want to further investigate it in a more sensitive fashion, I can simply put my finger pads there. So the idea of going from large to medium to small, or from macro to micro, and that all happens very well with a broad hand, or a broad hand posture.